anxiety, specifically those females who were housewives. And the cause of the children majority was related to the cause of anxiety was majority related to children. Prominent anxiety was found to be anticipatory type of anxiety, and the miasm of the anxiety throughout the study was prominently psychosis. Majorly, we have categorized into many kind of expressions like intellectual expression, emotional, psychomotor, behavioral, autonomic. But in my remedy, subconscious expressions in form of dreams were the abundant ones which we found. And the life situation which precipitated this anxiety were parental loss, economic crisis, unsupportive and tyrant husband, and discords in the family. Uh, so the conclusion of the study is, as we see the travel from childhood to the old age, we see that the void of love in form of parental rejection or loss of the parent runs throughout the remedy, which is known in the literature also. But economic crisis was one of the important precipitating factors since childhood, and the cause were death of the parents majorly, and both anticipatory as well as depressive anxiety was found in the childhood. In adolescent, additionally, the performance in terms of academics and schooling added to the earlier factors, and hence performance anxiety was also seen. From adolescence, we started getting the expressions. Majorly in adolescent, we got expressions at the subconscious level in form of dreams of some unsuccessful events like unable to complete paper, etc., dead bodies, dead relatives. And here, anticipatory anxiety was the majorly found anxiety. In adulthood, we got all the three type of anxiety, and here it is the epoch where maximum anxiety was found in the study. So the life situations were discords in the family, unsupportive and tyrant husbands or life partners, and economic crisis again in the family. And here we got abundant expressions, like in subconscious level, we got expression in form of danger, unsuccessful events, dead relatives, dead bodies, being dead. Uh, we got pathologies as well, like autoimmune pathologies, inflammatory, early onset degenerations were found. All the three type of anxiety was found in this epoch, but the prominent one was anticipatory anxiety. And in this epoch only, we could see the travel from anticipatory to the depressive anxiety, where after the resources have been exhausted, the person from anticipatory traveled into depressive anxiety. I've got very few cases where the anxiety was found in middle and old age, but it was mostly related to finances and children, and it was also anticipatory anxiety. So the type of diseases which I've got, which were associated with anxiety, were diabetes, cervical spondylosis, lumbar spondylosis, recurrent abortions, and there were autonomic expressions like palpitation, fumbling of the speech, loose stools, behavioral expression like trying to please others, marrying against the wish, etc. Thank you. Yeah, so the limitation of the study was uh, we couldn't generalize the extreme of the epochs because of the lack of the data in our samples, and there were many dreams which were indicating that they are belonging to the anxiety. But then there were certain dreams where we couldn't identify specific emotion. Thank you.
If you go to the dictionary meaning of the word evolution, it talks about the genesis. In the sense, it talks about the soil from which something evolves. So I didn't find anything of that conclusively in your study.
So, ma'am, as I've mentioned, that the word of love, which is mentioned in the literature, was the
So only
basis.
one
Yes.
causation you found throughout in all the
Yes,
cases.
yes, ma'am.
Only one constant causation.
Yes. And the economic crisis. Those were the two things which led to the genesis of the in magnesium carbon. From
Then
that,
have you qualified, have you differentiated the various expressions in various patients according to the same causation? Or
Ma'am,
are you concluding that the same cause and same expression?
no, no, we have differentiated the expressions at the level of epoch and at the level of whether they are autonomic, psychomotor, and in what epoch we got those expressions.
I have two questions for you. Because you are mentioning that a lot of things which you could see through dreams. Is there any certain criteria or a guideline you have used to interpret dreams? Because the way you have been mentioning death, so how you are seeing this as a part of expressions of anxiety?
Yes, sir. So, sir, there are certain psychiatric books also which were referred, and Nicholson's dissertation was also referred. I have personally gone to him also and talked about it. So now there are some specific events like mother's death, and then the dreams of dead relatives, and then the depressive anxiety. So those were something which were factual and we could correlate. But then there are certain patients' data where there was no live correlation or life situation which
So
were
have you
mentioned.
included those also?
No, no, sir, those were mentioned as dreams with other emotions which were not specified.
So there is one more question because one of the predominant findings which you are saying is the economic crisis.
Yes.
Okay. Now the sample which you have selected from the area where many people are facing this economic crisis. Okay. So how this factor will influence the external validity?
Sir, I have only 12 cases from rural and our center. The rest of the cases are from urban centers where either they have faced economic crisis of not of a major type in their childhood, or they are having minor economic crisis like paying loans, and they are earning well. But then also they are having severe and tremendous anxiety related to finance, which is not mentioned in any of the review of literature when I have gone through. So that is a new finding in the study.
एक 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 उसको
नहीं उसको पूछने देना हमारे क्या है मेरा भी
भाविक को नहीं
The only thing is, see, this is a dissertation on mathematics. So if a teacher of university somewhere wants to teach anxiety of migration class, how will you guide, will your dissertation guide them in preparing what books to refer and how they will in a nutshell summarize? It will be very brief.
Yes, sir. So basically, the source books they write abundantly about the expressions, but evolution was not found anywhere epoch-wise. So that is the new finding of the study. The void of love, which we all know about magnesium, runs through and through. Earlier, parents or parental rejection or absent parent in form of death of the parent. Later, tyrant husband or unsupportive life partners. So there has been void of love throughout the life, but we all know that the element itself is also very they are known for sustainability. So that was found even in the study that they can withstand a lot of mental pressure, but at the same time the body suffers, they pay cost in that way. So the genesis, the main feeling is same, but through and through it is difficult to identify because like what I found was magnesium is not a well understood remedy.
No, give where
So-
should they refer? My question is very clear. What
So-
should they do and where should they refer?
Sir, the basic source books, and very nicely it is mentioned in symposium volume. I think I could understand magnesium from symposium volume and the work done by Praful Barwale sir, which is published in the IGRH. So those were the two things which I could understand from the mind. Otherwise, the source book mentioned abundantly about dreams and experiences.
Sir, have you created a monograph of your findings? Is what I would like to ask. So, what is the unique of your dissertation? Have you created at the end a monograph that this is unique what you have found out?
Sir, for the case report, yeah.
No, no. At the conclusion of the dissertation, that this
Yes,
is
yes,
the
yes, it was done in the dissertation.
structure.
Yes, it was done in the dissertation.
That is there.
Yes.
Sir, put that in.
There is one standard instruction, probably people are not, please avoid writing acknowledgement on the any question. That takes away some space and full.
जरूरी सर, उनको लगता है सर फैकल्टी को एक्नॉलेज करना है.
नहीं एक थोड़ा suggestion is, see, you have been talking about epochs in your throughout the presentation. What I understand is they will have a limited value rather than the precipitating factor will carry more importance in generating the anxiety explosions. So because you see, I have not gone through your entire history, but they will have a limited value. And when you are talking of evolution, so you have to show the connections, if at all you are able to show it. And that has not come in your presentation. So henceforth, please take care for that.
Thank you. So, 001, HMM 001. ठीक नहीं, इधर से बंद कर बंद कर इन स्लाइड शो विजिबल और जो बेस कम है जो पूरा पकड़ लो अनरिक्वायर्ड चीजें ना उसका स्पेस अनवांटेड है.
So my topic for presentation is expression and evolution of anxiety in lycopodium through clinical cases, a retrospective observation case series. So anxiety is an unpleasant emotion with the expectation of some dreadful event that may occur. It arises because of some unresolved conflict or because of some age-related challenges. Now, lycopodium is a drug in materia medica which is known for its facade of anxiety and also mainly for its anticipatory one. But the other types like agitational and depressive are poorly explored. However, it becomes important to study the genesis of anxiety, which can be related to the life situations and how it evolves through the different to the different life stages from childhood to old age. So, to obtain this, 30 cases were selected purposefully and they were analyzed using life space table and mental state record. Then the findings of the cases which had adequate registration of lycopodium were selected and less than 5 were selected from the pediatric age group. The analysis of all the 30 cases was done using a checklist which included the preliminary details, all the type of expressions of anxiety of the three types and the other expressions and all the dispositions which were particularly there at the level of emotion, intellect, and behavior. The results obtained were that in my study, I found more from the middle age group and the adult age group. There was a predominance of male cases in my study, and the occupation seen was mostly at the managerial level. Uh, we will see the evolution and expressions together. So now when we see the evolution, the common background that was found in most of the cases was poor financial condition and authoritative figures in their life. So when this child of lycopodium grows, when he faces some situations like performing on stage, this leads to anticipatory type of anxiety with the autonomic expressions of trembling and sweating. So in these cases, the lycopodium child will either try to avoid or he will, with a good MWD, try to perform well. Then the same continues in the adolescent age, where there is again situations like performing on stage or other situations like social disparities, a teacher or differentiating between a rich and a poor student. So this again leads to anticipatory type of anxiety majorly in this age. then as the age progresses and he reaches the adult age group, there arises a situation where like facing a job interview, giving speeches, or completing tasks on time. So this again gives rise to anticipatory majorly, which is focused on his image and other situations like he falling ill. So this the anxiety then is centered on the health. So there is a shift of anxiety seen from that of the performance to the health in adult age group. Because there are some illnesses related to health, he also experiences agitational type of anxiety, where there is continuous uncontrollable thoughts. With this, we found that particularly in the adult age group, there were body expressions, mind to body expressions, like certain diseases and autonomic imbalances more commonly seen. Here also, the lycopodium tries to cope up by planning or being punctual and facing the hardships. As the age progresses to middle age, again the diseases continue, and this causes an impact over the patient. It's the mainly seen anxiety in this is anticipatory and depressive about the health, and when there is death of near ones, this also leads to the depressive type of anxiety. In the old age, he faces situation like having no child, having no hire, or a child staying away from him. So this causes a feeling of loneliness, which he tries to overcome through religious activities. So the main common type of anxiety seen in this was depressive type. So there was a travel of anxiety seen from the anticipatory agitational to the depressive one in the old age. It can be concluded that um, the common background was poor financial condition and the purpose. There was one additional finding that the purpose and the coping of lycopodium could be studied through this study. The limitations were the study was conducted in a single clinical setting, so the socio-cultural differences may have occurred.
One question. How is the she also has the same evolution, or it's only the he which you have found as the same evolution?
So there was predominance of male cases.
Yeah, you got a certain amount of 20 cases, I think, as female.
No, sir, only five.
Five. So, was there any difference in the she in this anxiety evolution?
And
Or
mostly, individually in the cases, it was mostly related to the family members in the she.
From where comes the question of evolution and how you will cross-examine the gender.
Yes, sir. Yes, ma'am. That was a limitation.
So when you interpreted this Meyer, you have taken only the anxiety part, or you have taken physical expressions and everything?
Also, or the mind to body effect or the expressions or everything was considered. Overall, particularly of anxiety related.
Practically,
Yes, ma'am. So this study provides certain indications of where lycopodium can be thought of by studying the whole life space of the patient.
where are those indications?
So, ma'am, actually, we have we have seen expressions.
When you are saying of indication, they have to be listed somewhere, no? Because the patient will come to you with expressions. It's a checklist, no? So you look for this syndrome and you can definitely control items. You could have concluded.
We can draw the indications to these types of anxiety which was commonly seen. So it is mostly centered about performance, family, image, in the end.
And also about the expressions.
Yes. The particular expressions were not noted; they were general. Also, like there was a purpose. So these can become also the if we study the whole patient, then we can identify.
Mention some of the expression, agitational, anxiety.
combination of evolution and expression, both are important. Means not only expression will decide on the other, but the correlation with situations and expressions. So expression will be distinct, but its connection with life situations and over period of time is what will make it individual. Thank you.
Psychiatry 002. फाइनल में जा रहे हैं फाइनल फाइनल इधर नहीं फाइनल में किए तो उनका फाइनल में सब रखे हैं बट बार बार इधर इधर
नहीं अभी वो खुला था इसीलिए।
मेरा ऑब्जर्वेशन नहीं है मैडम का।
Zoom it out as much as possible.
Good afternoon, everyone. So today my topic is so everyone had parenthood is a very beautiful journey. But what happens when the plans go unchanged? What happens when the parents or the caregivers faces the diagnosis of disability? They go through an emotional turmoil. There is a big denial that this cannot happen, or they keep on blaming the situation that they did something wrong, or it may be a God's punishment. They go through a lot of daily struggles, medical monitoring, treatments, financial strains, family conflicts, and lack of social support, as we all know. Witnessing a journey in, a, in my family of my cousin who is suffering from cerebral palsy, I know how the caregivers come up with a lot of strain. So there is an increased burnout, increased risk of mental and physical illnesses, and definitely the emotional exhaustion. How often do we see that these people are having devoting their time, dreams, and aspirations for taking care of the child? So the research gap was identified that there is no any structured help that can be given when the caregivers are approached. Coming to the so I tried to identify the stressors which were there. So the screening and assessment was done using the general health questionnaire. Later on, the scoring which was above 11 for anxiety and depression was given further. Another psychometric assessment was Hamilton Anxiety Rating Scale and Depression Rating Scale was applied, and a detailed homeopathic case taking was done. So, while dealing with these cases, there are factors at the level of biology, psychology, as well as the social aspects. We could identify that the stresses were related to the childcare duties. So, one of all of us somehow know that these are the stresses, but when it comes to all of this comes to us at once, it becomes very overwhelming. And to provide a resolution was the most difficult aspect because how can we fix it all? Because if we are trying to tell them that go for a walk, it is a very simple resolution. But the another question that will come up suddenly is how can we go? Who will look after the child? Because there is no support from the society or even trying to tell that make child eat some healthy diet. But what about the finances? So the struggle was in every aspect. So understanding this stresses becomes a tedious task and then providing the resolution. So all of these stresses we could identify with the help of the GHQ were further classified into normal category where the parents were not distressed much. So a preventive aspect kind of strategies were given, whereas in the mild category, this kind of caregivers came up with the physical illnesses. But in the moderate and the severe category, we could see the extent of the system involved where multiple as well as the mental illnesses predominated. So while dealing with these stresses, the parents' emotional burden was seen across all the categories where the lack of knowledge and skill gap was predominantly seen in the cerebral palsy's caregiver because their physical dependence was more. The denial towards disabled child was more seen in the caregivers of autism and ID because the child looked quite normal. How do we explain that the child would not be able to cope up as other children?
So that all were the issues. The child's behavioral issue majorly faced by the AHP caregivers. Coming to the resolutions, all of these resolutions were used in a permutation and a combination. There is not a single strategy that was used because the problems were highly individualized for the resolutions. So all of these resolutions can be used. For example, if we try to see the stresses related to the finances, so we can try to ask, start a small scale business, but for that, the emotional support, the motivation, and the family bonding activities as well as the support from the another partner would be required. So in that aspect, a physician need to decide in which aspect it is to be given. That is one of the limitation of my study. Because in general, it can help you that this all the points can be explored. And another interesting aspect was in moderate and the severe category, the monitoring. The suicidal risk assessment was very essential.
Can you conclude in one line or
I guess it requires a lot of hands to understand their struggles and help them out. Not a single person can do it. That was the major learning. Because maybe the nursing care, the therapy, the management, it requires a lot of hands.
Just show me the title.
Can I ask the question? Your title talks about creating homeopathic and psychoeducative models for alleviating stresses in parents of children with disability. What is the homeopathic part?
So, for the homeopathic aspect, the intervention was given like acute chronic intermittent and biochemic as
That's
required,
very important.
as well as the correlation was made with the conflicts. So we have identified the conflicts in the caregivers, mainly related to the, we can see that plant kingdom where those patients who had been prescribed with the plant kingdom remedies, they were highly sensitive. Whereas in the moderate and the severe cases where there has been a lot of exhaustion, the nosodes were also prescribed, like carcinosin. So that was the homeopathic aspect.
The presentation focused on mainly only psychoeducative part. So I have to ask this question.
what is the like homeopath who are seeing this patient? What is the step they should follow? Because there are a lot of strategies and lot of resolution you have proposed. So what is the way one should go ahead? What is the application for a regular homeopath? Non-psychiatric homeopath.
Correct.
Yes.
Because unless the scale is used, how will a common scale work?
अरे तिला उत्तर दे.
Basically, when a homeopathy is trying to understand, we often do not ask about the suicidal risk assessment in the general aspect, but that is present. So, one of the steps we should ask the question. Filling the scale is not every time necessary, but even if we make an inquiry in 2 or 3 and we feel that it is there, we should further go ahead because they never spoke in one time. So, I had to frequently ask and inquire.
How many could acknowledge your cure for?
Uh, Sir, Chetna ma'am tried, Hiren had tried.
Really, I'm not asking the number.
Many of them have.
Ah.
Medicine 02.
Good afternoon, everyone. So, my topic for the dissertation is scope of homeopathic medicine in the management of psoriasis vulgaris using psoriasis area severity index scale. So, psoriasis vulgaris is a autoimmune disease which is chronic inflammatory disease, a disorder with erythematous scaly plaques and itching. So, mainly in modern medicine, the conventional therapy offers steroids, immunosuppressants. So, with that type of medicine, there is continuous remission relapse period. So, no proper cure is obtained. So, there is a need of a holistic healing method. So, homeopathy offers that. So, in our study, combines homeopathy with the scientific evidences using the PASI scale. So, our aim and objective was very clear to assess the role of medicines using the scale. Now, sample size of 30 was selected. Uh, Inclusion criteria was age above 17 years, both sexes, patients which were willing to stop the external application before 4 weeks of starting the homeopathic treatment. Exclusion was pregnancy uncontrolled, diabetes, and other skin conditions. Now, PASI scale contains 0 to 72 score total of. It was calculated at baseline, third month, and sixth month of the study. For this, Shapiro was applied to know that this data is non-parametric and not normally distributed. Hence, Friedman test was applied, which was highly significant. Now, these are the observations and results in which it is evident that after giving homeopathy, there is marked improvement in 16 patients out of 30, moderate in 10, and mild in 4. Marked improvement means more than 75% of improvement from baseline to the 6 months. Moderate is 50 to 75, and mild is below 25, 25 to 50. Now, this is the PASI score distribution is 0, 3, and 6. It shows a mean which reduced from 12.6 to 3.72. Now, at baseline, the minimum score was 1.1 and maximum was 47. And after 6 months, the minimum was 0.3 and maximum was 27. Now, these are the tables which represents the PASI parameters of PASI scale itself. It contains erythema, induration, scaling, and area. Itching was also seen that itching, erythema, induration, and scaling started to reduce within the 1 month, but the area started to reduce within. It took 1 to 2 months to start resolving, which proves that functional uh, things resolve first, then later structures. Now, disease severity, the patients were classified into mild, moderate, and severe. Severe were less, that is 20%, moderate were 33, and maximum number was of mild psoriasis. Now, management strategy adopted was mainly 73% were given CR and 27 were given intercurrent along with CR. So, out of the 30 patients, we tried to identify the causes. So, no causes were identified in 16 patients, out of which 8 were markedly improved, and the patients with mental causes, out of which 7 were markedly improved, and physical cause was 1, and it showed marked improvement. Now, mainly the potency used was centesimal potency, 200, 30, and 1. 200 was given to majority of the patient, which is 63, and LM potency was given to 27% of patients. So, uh, this proves CM and LM both in frequent repetitions proves to bring marked to moderate improvement in many of the patients. Then, along with the PASI, we also tried to observe the exacerbation and remission during the course of the patient in 6 months. So, exacerbation, before starting the homeopathy, it was seen persistent in most of the patients and low frequency. Low frequency means 1 to 2 episodes per year. But after starting with homeopathy, it drastically shifted. No persistent and no high frequency exacerbation was seen. Low and none relapse were there, low frequency and none. And remission, about remission, uh, is same for that. That short term remission and no remission was there before HM, and it reversed after the starting of exam. Then my learning from this is that I learned the approach to the dermatological cases that we get variety of cases, autoimmune as well as hypersensitive and much more. So we cannot just fix one treatment approach and give everyone that. So that is the major learning about the posology, judicious use in follow-ups while starting the treatment. And I, my personal as well as research, I grow as well as personal as well as physician, and I learned about the physician and patient relationship, how to maintain that, how to connect with the patient to get the data, and patient will help us to complete our research. This is my major learning.
So your introduction talked about how homeopathy, allopathy has a limitation, and the homeopathy is a holistic. So how does your design justify your introduction?
So we are seeing the scope of homeopathic medicine. So we have seen the various by various methods how homeopathy has helped the patients. And sir, during the data collection, I got the mixed number of patients, like which have used steroids, which didn't have used steroids, and which means have left steroid long back. And
Your criteria is not using steroid. No?
yes, sir.
Now you are saying you have got a mixed one.
Mixed means sir, which doesn't have used before the homeopathic treatment, which have used and left currently, and which have left before many years before.
So one more question, because a lot of work has been done on psoriasis using PASI. In fact, there are a lot of control studies are also available. So what is the new thing which you want to propose from your study?
So I didn't find any study with 30 sample size, with much sample size, and without any use of steroid. With they didn't have observed without steroid, and the scientific evidence with PASI scale. It is the objective method.
One question, what is the major limitation of this? What did you find that is the major drawback on this?
But it could have been to the broader aspect, not limited to this region or this area, because if we are limited to this area, then we get the seasonal aggravations or the exacerbating factors related to here only. If it is wider, then we can get the wider range and we can identify other causes also, which can affect the disease course or can start the positive modality.
Your duration of the study is 6 months.
Yes, sir, this is also a major
That
drawback.
was the main issue. That
You have used, so I think I just explain to that. How do you compare your findings with the existing published studies?
For it is correlating with the existing study only that homeopathy has a scope in managing these cases.
No, scope we know. How are you going to justify what is published and what you have said? Is it correspondence or is it difference with what you were talking?
No, sir, it is totally in the correspondence that whatever the findings we got, be it from epidemiological to like potency to repetition, everything given in literature or previous researches, it corresponds with that only.
You said there is no other studies which are using PASI, that's why I'm asking.
No, ma'am. No, sir. There are various studies which have used PASI, DLQI. There are studies. Yes,
You
sir.
only said there were no.
No.
There are.
No, I have took references of those studies.
your conclusion, one of the conclusions is frequent repetition. So whether all the studies has frequent repetition, what do you mean by frequent?
So in my study, frequent repetition, I have considered 3P and 7P cases. Sorry.
Thank you.
Don't influence the market.
No, I'm not influenced. I'm telling
Wrong question.
Option number one.
should be my colleague.
भूक लागली मला
हो ना, आम्हालाही भूक लागली.
विनर कडनं भाजी घ्यायची लगेच.
कोण देणार?
चल,
इथेच दिसतं.
काय रिझल्ट
Good afternoon.
चल.
Good afternoon, respected judges, faculty and all my resident colleagues. So the title of my dissertation is Scope of Homeopathic Medicines in the Management of Contact Allergic Dermatitis using the Eczema Area and Severity Index Scale and the 5D itch scale, which is an uncontrolled experimental study. So, as contact allergic dermatitis, it is a type 4, which is a delayed hypersensitivity reaction. So, it is not only a skin condition, it not only contributes to the physical manifestation like itching, redness, or in chronic cases, eczematization, but also in the psychological and social consequences due to its persistence and visibility. So the 5D itch scale and the eczema area and severity index scale was used for the scientific outcome and measurable outcomes. So the aim was to evaluate the scope of homeopathic medicines in the management of allergic dermatitis. So the methodology used was study design and uncontrolled experimental pre-test post-test design. The sampling technique was simple random sampling. The sample size was 30. The inclusion criteria was diagnosed as per the International Classification of Disease of Allergic Contact Dermatitis. Age group was 18 and above, and also the patients who have stopped the use of steroids and antihistamines 4 weeks before start of treatment. Then 5D scale and the ESI scale was used every month for a period of 6 months. The data analysis was done by the SPSS software via the Wilcoxon rank test. As we can see here, there are the network diagram of pairwise comparison for the itching scale and the eczema area and severity index. The yellow it shows the significant result, whereas the black it shows the in the second and third month the result was not significant. So these are the observations of the study. In the conclusion, as the data was analyzed firstly on the age-wise, gender-wise, and occupation, so mostly it was common 18 to 57 years of age group. Females were the most commonly affected, 67%, and in the occupation, housewives were the most commonly affected due to exposure to the cosmetics and allergens. So you can see itching in 56.7%, there was complete relief of itching was observed, whereas in the eczema area and severity score, 96.7% resulted almost clear. Also, the quality of life was observed because it is a parameter of the 5D itch scale. So, there was a 100% improvement in the quality of life. There was no disability. And looking forward for the scope of homeopathic medicine, the prominent remedies would be found where the lycopodium, natrum gold, Silicia, causticum, and Calcarea carb. The Wilcoxon sign rank test which showed a significant decline in the PSI 6 scale. So the p value was less than 0.05, which is a significant result. Also, the limitations were the study duration was insufficient to look for the longer effects of homeopathy after exposure to allergens. So here in the observations you can see the quality of life was shown in the housework, work area, social life, as well as the sleep.
The remedial strategies used in the where 30 cases constitutional remedy was used, and in 5 cases intercurrent with constitutional remedy was used. Also, the prominent mental expressions that were concluded were in 21 cases anxiety was seen. In 20 cases there was hypersensitivity, followed by in 11 cases sentimentality and fearfulness was observed. The type of allergens we found were in 10 cases it was unspecified, followed by preservatives and fragrances and dye, metal, and piperidine dyes.
So what is the novelty of your study?
The novelty of my study is that it is an evidence-based study because the previous studies which I referred, no scale was applied. Fire. And also the case reports which I saw, there were no like the concept of susceptibility or miasm was also not given. It was not up to the mark. So in this study,
You have used miasm or anything in your study?
yes,
How, where it is represented? Because if that is a new, then we would like to see that.
not written
You
this.
can share.
Psychosis was the dominant miasm in 27 cases, followed by psychotube in 3 cases.
Any impact on management? Once you diagnose that there was psychotic predominantly in some cases, so what has been the impact on the management due to that? That is probably a novelty. Yes. What was the impact on the management? How do you use this information in the and or how you have understood?
So,
So we define no, that this is predominant psychosis. You have to use that data. No? How have you used that?
so it has helped me for prescribing, depending upon the considering the miasm also.
Antimatter you are doing 5 cases. That is also only 25 cases only CRU.
Yes.
In 5 cases you have used antimathematic with CRU. So that is also very interesting. That you are and what kind of remedies have come? Which miasmatic predominance remedies? What are the remedies that have
Lycopodium nitrum.
Sachin sir and Nikita madam just take their experiences in my
Hey, I'm sharing one feedback form to entire batch. Please write now, Mila. Please, those who are the participants. You all have received the Google link. Kindly give the evaluation feedback, please. Unless until everyone will not feel the prizes will not be declared.
or participate.
Oh, they are filling. By that time, I thought.
This step project. Next time, announce one prize for best feedback.
Oh, तो फिर आएगा फिर that.
Thank you. Let's go.
Giving their you done? Done, na? So now you check feedback. Now they have filled up the form. हो गया ना? उसके नहीं बना पहले हो गया देवांगी ने भेजा उसके पहले हो गया था एआई होता है ना एआई हैड एंटिसिपेटेड देवांगी से क्या आने वाला है तो ऑलरेडी वर्क के डाल दिया है ना बना हाँ when you do repetitive things you become predictable AI is predictable बोलेगा feedback from देवांगी तो पता चलेगा
इसको तो लिखना है वो क्या लिख रहा है
वो ट्राई कर रहा है ऐसा कुछ होता है क्या नेक्स्ट टाइम से ये झंझट वाली कम एक बार करना चल ये स्टार्ट
So, all the MD Part 2 students who are now going to start their dissertation, I would like them to share what did they learn from today. How many of you were there as your friends were presenting? What did you learn? Please come. You were there constantly with everybody. Nice one. Three learnings from observing the competition. कुछ सीखा आज सीखा ना वही तो था
एंजाइटी डिप्रेशन की लाइन होते हैं वो आइडिया नहीं एज अ रेमेडी कर सकते हैं वो एक ही बता देता है ये एक्सप्लोर करने क्या है वो एक था बाकी ऑर्गेनाइज डिपार्टमेंट का अटेंड किया उसमें
क्वेश्चन पूछे इतने डेप्थ में सर्किटरी वगैरह को लेके तो तीन साल आ गया तो फिर तो खत्म ही हो गया मैं तो समझ पड़ गया क्या ठीक है वो तो मेरे को पता चला कि इतने डेप्थ में पढ़ना पड़ेगा अगर सर को कोई आपको पूछ लेगा तो इतना पता होना चाहिए इंसान को कि वो बोल पाए उसमें को कि ये बात है सुपरफिशियल जैसे हम चल रहे हैं वैसे हम चलने वाले हैं। हाँ validation data set of validation data set of वो उसपे मतलब PMP और RDS मेरा टूल है वो डॉक्टर शीतल का भी टूल था तो मैं रेगुलरली और कैसे क्वेश्चंस पूछ रहा हूँ इस कहीं पे भी नहीं हुआ तो अभी तक रियलाइजेशन एक आया काम करना शुरू कर दिया पर किस डेप्थ तक जाना है वो भी समझ रहा है सकता जाऊंगा
कुछ भी सुना नहीं होगा सुनेगा तो अप्लाई करेगा कि नहीं और कुछ सीखा नहीं ये मेरी कॉन्फिडेंस मेरे
Hello, learning like I like the way of presentation. Everyone presented very well presented in a very few minutes. Like it is a really great task to show your presentation in just 5 minutes through a poster. It takes a great effort because we have working since 2 years on one presentation and we are putting all those efforts in one sheet and presenting it only in 5 minutes. So I like the way everyone presented, the way of oration, the presenting skills, how to present everything in a one sheet, how to explain whatever we have did. And whenever the judges are asking any question, how spontaneously everyone is answering and communicating the question and answer, and engaging the audience, having eye contact, having the communication, all these things I like. Yes, Dr. Kanu.
जैसा अंजलि ने कहा कि तकरीबन साल भर का डेजर्टेशन 5 मिनट में एक्सप्लेन करना है वो भी लिमिटेड स्पेस में दैट्स रियली ग्रेट एफर्ट एंड सबने अच्छा किया है और सब मतलब आप जब आप क्वेश्चंस पूछ रहे थे और सजेशन दे रहे थे तो मैंने मतलब मैं जो सुन रहा था दैट विल आल्सो हेल्प मी इन माय डेजर्टेशन कि कैसे स्पेसिफिक रख के मतलब डिस्प्ले करना है पोस्टर पे या फिर हमारे डेजर्टेशन में और सबसे एक जो मतलब मेरी आज की लर्निंग में कहना चाहूँगा कि जैसे सर ने डॉक्टर ओंकार के सो दैट वाज रियली मेस्मराइजिंग क्योंकि ऐसे कभी मैंने सोचा ही नहीं था ना ही मतलब कभी मुझे करवाया गया था कि हाउ टू एनालाइज पास्ट हिस्ट्री एंड टू फंडामेंटल मायरिज्म जैसे अभी चल रहा है तो दैट वाज वैल्यूएबल।
नहीं तो नहीं मिली। तो मैं हमला का फ्रेंडली टॉक चल रहा था, फ्रेंडली टॉक चल रहा था ना।
डॉक्टर दिव्या
हाँ, उसको क्यों इन्फ्लुएंस कर रहा है भाई बिना बात? हाँ? तुम्हारी भड़ास उसके ऊपर मत निकाल।
let her share please. So we have the various types of cases where one can given result. So we had learned that how we approach the cases and what kind of result we expect. And most of the dermatological cases, psychiatric cases, and then what kind of research we can take and how we expect result and then we how we present the case and usually 3 minute and how to summarize and what kind of mistakes seniors had made, we have to not make that kind of mistake in our presentation.
उन्होंने प्रेजेंट किया उनके भी एक्सपीरियंस है।
सुनने के लिए आए, सर्टिफिकेट लिख रहे हैं सबका। तो ठीक है, तो सर्टिफिकेट तो लिखना नहीं है।
बाकी तुम्हारे कपल ऑफ जजेस के एक्सपीरियंस है।
हाँ, अभी
प्राइमरी
एक्सपीरियंस
बाद में
बाद में
I think it was a very appreciable hard work in the what we did. In a short time. Making, I thought many residents were not there 1 week prior and suddenly everyone was there. The poster competition has created a lot of anticipation and excitement. I think we should keep it more such events more frequently. But I think all have done really. The only thing that needs to be is that how you present it and what areas you should focus on. सो हम हमारे को यूजी में सिखाते थे ऐसा आंसर को कि नेक्स्ट क्वेश्चन आपको आए वैसे ही पूछे है ना, ऐसा था ना। नहीं ऐसा मत बोलो कि वो नहीं आए, नहीं तो वो उधर लेके जाएगा। तो दैट स्किल probably needs to be evolved. Someone had tried to evolve at that level, but no. So now when you are attending your final exam, when you're presenting, try to focus on innovation, new things that you have got, no comparison with what already studies are. No, I think the questions that came up from the judges, I think really help you in more organizing and presenting your dissertation in a better way in your final. Okay, so good job done, very, very well.
Brahma. As Bhavik sir said,
इधर बोला पड़ता।
as Bhavik sir said, it is nice to see all doing focused work when it comes to poster. So I think the people do a lot of hard work while collecting or working on the dissertations. So I think via the medium of poster making, you all must have understood the importance of that hard work. Yeah, otherwise many people think that it is a trolling or it is a tedious journey collecting cases, and people are not so very happy while doing the dissertation. But I'm happy to see that people are happy while making posters. So I hope the whole importance of the entire exercise becomes relevant at the end of the 3 years journey at least. And second thing is that I think when it comes to presentation of posters, that art of presentation needs to be learned. And that also allows you to reflect on your mind. What is, see, it is your work. So what is the priority of that work which you want to present or which you want to bring about in front of the audience, that comes through your presentation out. So all should do the retrospection in that light, and this will prepare you all best to answer your vivas in the final exam. Good job.
सर्टिफिकेट लागू है.
Sir, I want to know your point of view.
टाइम पास करना है. See, whatever I have observed, I mean, there are ways in which you integrate. Tell me how many of you have read your abstract and made the posters? Raise your hand. Yes. That's the best way to do poster. Correct? The second important thing which I could not observe was, when you say what new, that means what was known to unknown. We just knew ये finding है, लेकिन क्या known था? क्या known था? ये वो discreetly posters में नहीं दिखा. Because you had, put lot of space for your graphs. But what we needed was only relevant information. So that is the way how you look at the outcome. So when you prepare your poster, the first important thing is what is the gap? Okay, what is the gap? What ought to be known and what is known? The next important part, this is important for your exams. What methods employed, and then what is the journey from known to unknown? So your conclusions are automatically coming. So it's a flow. You save a lot of time in speaking something which is not relevant actually. That would have saved time and remained focused for the people who have extended time. Doing so much of hard work, I think it was an extensive study. वो एक डेजर्टेशन से 5 डेजर्टेशन बन सकते थे. सुनीता मैडम
5 आर्टिकल तो बना देंगे.
नहीं, आर्टिकल तो 25 बन सकते हैं उसमें से. I tell you,
5 बना देंगे.
और दूसरा एक लेसन मैंने सुना.
Very chic. हाँ, तो 5 आर्टिकल तुम्हारा वाइवा उसी पे होगा.
I mean, the dissertation is not of passing. The whole process is developing mental processes. How do our mind operates in a specific task which we take up? So starting from collection of data to the conclusion, how many faculty of mind are we using? This is a conscious effort in developing those capacities of collections, of process, of analysis, of synthesis, of abstractions, of comparative study, and how do you summarize and conclude? SCR वही है ना, पूरा SCR भी वही है. So how do you integrate all this and develop those mental faculties which are so essential for practice in life, number one, and for having a quality life, not practice, quality life. if you are able to analyze patiently of what is happening in your circumstance, learn to synthesize and abstract and then respond, will it make a quality difference to your life, your reactions? Now you reflect back whether the dissertation did all this to your mind. Yes. So please don't take these processes as one of the academic compulsions and completions. Take this as a process in which we graduate to postgraduate. And then it teaches you that whatever you have learned, how to comprehend it, conceptualize it, communicate it. Today you communicated your findings, right? Then defend it. See how many things which happens in a day. So these are important for a homeopath to have a successful practice, number one, and to a human being, both. So I mean, lot of thanks to the research department for taking this pain. And as Avik sir has said, next time we will organize poster competition exactly 2 days after Diwali. Thank you.
I think poster competition was not exclusively for the resident. The poster competition was also for the faculty. And I think we once again realized the importance of cross faculty assessing what has been done. I think all of you have really gave a good insight in which how we as a MLD MHI can enhance the standard from various angles. So I wish that more interdepartmental faculty inputs can be encouraged so that we get a better proposal. So collectively, we can do a better dissertation, which are applicable for the wider masses. Because when student and guide both are in the same boat, they start seeing a particular journey. Okay, and sometimes it happens that some of the important parts are components are missed. I think that becomes the crucial for becoming overall dissertation. I think the cross faculty will definitely contribute in bringing that, and that would be a better way. Okay, so we are handing over this to once again to cultural committee. Thank you, cultural committee, for always being present.
Cultural committee कुठे आली रे? Why are you overstretching them? अरे, this is work of.
We always thank contributions.
This is MET and academic committeeचा काम आहे.
Okay, MET, thank you, MET committee. Thank you, academic committee. Thank you, principal sir.
बोल दिया, पहले ही बोल दिया. Thank you to
So
research
please,
department.
judges आ जाओ इधर. Judges सब आ जाओ.
बस
चलो एक.
सब लोग दे देगा ना
मुझे
भी नहीं खाया
बस प्राइस तो उनको ग्रुप में नहीं आएगा.
Prize group में नहीं है. Everybody is winner. There's no question about it.
नहीं. डिपार्टमेंट पार्टिसिपेंट से उनको करना है, तो एवरीबॉडी डिपार्टमेंट वाइज आ जाओ फटाफट.
Very good evening, everyone. Now I request everybody from the medicine department to please come on the dais. And I request Shama ma'am.
सोनम. आ जाओ इधर.
चलो फटाफट.
Nandita ma'am, Sarma ma'am. I request Bitul sir and BPT sir to please hand over the certificates to the participants.
आ जाओ सब collectively.
अरे इधर इधर.
प्रशांत आ जाओ.
चलो ले लो जल्दी. रंगनी आ जाओ.
नहीं
एक मिनट
नेक्स्ट डिपार्टमेंट बोलता हूँ।
Next department is psychiatry, so be ready.
चलो सुनीता मैडम सेकेंडरी जल्दी आ जाओ। ठीक है।
Next is pediatrics department, please be ready.
Sir, आजा अभी तेरे साथ।
I request the pediatrics department to please come on the dais. Next is organ department, please be ready.
आगे करिए।
Next is laboratory department. I request organ department to please come on the dais.
ए दे दे।
I request the organ department to please come on the dais. Next is laboratory department, please be ready.
अरे कौन है? नहीं है। अरे तू क्यों ले रहा है? क्यों ले रहा है?